Great. So I'd like to, again, thank you for joining us for the UofT talk session today, which is titled, Reaching the World's Hardest to Reach. And we are very fortunate to be joined by Professor Joseph Wong to deliver this mock lecture today. Professor Wong is UofT's Vice President International, responsible for leading the university's international strategic plan, which guides UofT to deliver on its global promise and profile as one of the world's leading universities. In addition to this role, he is a professor of political science and is a committed and well-respected educator who teaches several undergraduate classes. Professor Wong currently leads the UofT Reach project, which engages UofT students from across all disciplines to examine the delivery of social services to the poorest of the poor, the world's hardest to reach. He is also the co-founder of the Global Ideas Institute, which provides intensive research and mentoring opportunities for high school students. Professor Wong has worked extensively with the UN and the World Bank and has advised governments on matters of public policy in Asia, Africa, the Americas, and Europe. And to wrap it all up, just like me, he is an avid Toronto Raptors fan. So without further ado, we'll pass it over to Professor Wong.
Great. Thanks so much, Adam. Good morning, good afternoon, good evening to everyone on the call. This is a real pleasure for me to be able to speak with so many of you today. As Adam's pointed out, I continue to teach undergraduate courses. It's one of the most amazing privileges we have here at the University of Toronto. And even though now I sit in the Vice President's office, it's still incredibly important to me to be in the classroom, to be engaged with undergraduate students, as well as to be learning from all of you. I'm also a really committed researcher. And so one of the great opportunities of being at a university like the U of T is to combine our research and teaching and to see them really as two sides of the same coin, sometimes even two of the same sides on the same coin. And for me, it's imperative that we try to integrate the kind of research and teaching that we do so that students such as yourself have an opportunity to not only be learning from books and lectures, but also being in the lab and in the field. And that's actually what I want to talk to you a little bit about today in terms of my own experience in the field and ways in which I'd like to see that integrated more into some of the teaching and research that I do. So this is a photo of any slum in the world. As it happens, about 8 years ago, I was doing some work in Addis Ababa in Ethiopia. It was actually part of a larger project for USAID on governance. But on the side, the driver of the car that I was in said, do you want to see where I grew up? And I said, yeah, sure, that'd be interesting. So he took me into one of the many slums in Addis. This was one of the first times I had certainly been in a slum in Africa. I've worked in others around the world, but this was a particularly deep experience for me. And we had an opportunity to hang out and to really make our way through, as you can see in this graphic, a real labyrinth, a real sort of physical labyrinth of a very densely populated urban area. And one of the things that I noticed, and I remarked this to the driver, I said, how do you find your way around here? Like, there are no street signs, there's really no seemingly order to this. And most importantly, there are no addresses here. So how do you figure your way around here and how do you navigate this? And his response was quite predictably, he said, well, I grew up here, so I know this area really well. But you do raise a good point, Professor Wong. I'm not sure that government knows where and how to get around. I'm not sure that businesses know how to navigate their way around these kinds of slums. And that got me to thinking, if we don't have people's addresses and we don't have these kind of what I call administrative technologies, then how do we actually get things, important things, to people who are, for all intents and purposes, invisible? How do we get clean water to them? How do we get schooling to them? Indeed, as we are living through the pandemic today, how do we get vaccines to people if they are, for all intents and purposes, invisible? So it was around this time I started thinking about this question as a political scientist: how do we get stuff to people who are invisible? And it was around this time that the entire world was engaged in conversations about the Sustainable Development Goals, or the SDGs. And these SDGs came into effect in 2015 when most of the world's governments around the world signed on to this very ambitious agenda, chief among which is SDG number 1, which is to end poverty in all its forms everywhere. And this was a goal that struck me as something that I think we should all strive towards, but it also struck me as profound because it wasn't saying let's reduce poverty in some places and in some forms. It was quite unequivocal. It was eliminate poverty in all its forms everywhere. And indeed, one of the axioms that's attached to the SDG agenda is to leave no one behind. Not a single person can be left behind. So it's the combination of these two things, my being in the field and really starting to ask questions, well, how do you get things to people if they are invisible? And then it just so happens that the entire world signs on to an agenda that basically says no one is to be left behind. And so this prompted me to ask the question then, how do we reach those who are the hardest to reach? In other words, how do we get stuff and important stuff to everyone everywhere, which has now been the tagline of the REACH Alliance, for which I'm the PI. Over the last 6 years, we've recruited over 150 undergraduate and graduate students at the University of Toronto from all disciplines, from the humanities to medicine to engineering to pure maths to performance and music. We've recruited students from across all disciplines to work together to uncover and examine how we get important stuff to everyone, everywhere. And these are student-driven research projects that work with the world's hardest to reach populations, the world's poorest of the poor, the hundreds of millions of people who do not have any ID. I mean, one of the most troubling statistics, according to UNICEF, is that 230 million children under the age of 5 do not have their births registered. Working with people like that, working with people who live in the most remote areas in the world or who live in the depths of some of the poorest slums in the world. And together, working with these students and faculty researchers from engineering, management, the social sciences, and so forth, we've uncovered many solutions. And we've looked at many interventions and many really innovative interventions on how to reach those who are hardest to reach. We've worked with drone technology companies, for instance, to discover ways in which we can be delivering health care services to those who are living in the most remote areas. I'm mentoring a team right now that's working with maternal health care workers who, equipped with a remote solar panel and backpacks, are able to reach indigenous women in rural Guatemala in order to be able to administer some diagnostic screens and diagnostic tests for expectant mothers. We've worked with GPS grids all the way to hand-drawn maps in India. We've worked with companies dealing with iris technology to help in terms of cash transfers, all the way to technologies around universal IDs. And our students have had an opportunity to share their research in global stages such as the United Nations, Global Affairs Canada, the World Bank, and so forth, and have published many of their findings in some of the world's leading journals as well. Now, so that's really cool, and I'm very proud of that work, and I think it's extraordinary, and I continue to be inspired by the faculty and students who are engaged in this. But as Adam pointed out, I'm a political scientist, I'm a political economist, and so I'm interested also in the relationship between politics, economics, and indeed the kinds of questions that we're interested in terms of reaching those who are hardest to reach. So as a political economist, it's probably not a surprise to you that notwithstanding all the terrific insights we've gained from learning about these technologies and innovations and so forth, I actually want to know, how much does all of this cost? Because in the end, as a political scientist, as someone who advises governments on public policy, I need to be able to make, or I want to be able to make, a policy case. I want to make the business case. I want to make the economic case that reaching the hardest to reach is something that's feasible and indeed something beneficial to all of society. So I'm interested in how much does this cost? And this takes us anyway, at this stage of the conversation, to a research project that was part of the REACH project that I led about 2 years ago, looking at logistics, right? Logistics management or logistics optimization in Tanzania. And essentially the question that we asked was, how do we deliver essential medicines and vaccines to some of the most remote, out-of-the-way health clinics in a relatively poor country like Tanzania? And we started working with the Tanzanian government. And as it turns out, there was a company operating in Tanzania that had also been giving advice around this very specific question. And this company was Coca-Cola. And the reasoning was that, or the reasoning is, the thinking was Coca-Cola is a company that is able to get, whether you like it or not, is able to get a bottle of chilled Coca-Cola to practically anywhere in the world. Now, what does Coca-Cola do to get vaccines and medicines to anyone in the world? And so working with what's called the Medical Stores Department in the Ministry of Health in Tanzania, as well as with companies like Coca-Cola and NGOs like John Snow International, we started to uncover different kinds of logistics optimization strategies. And this is one of the ones that I want to showcase here. This is essentially a route map. This is the map that trucks will drive in order to deliver vaccines and medicines to all of these clinics around Tanzania. And so you can see on the left a kind of hub and spoke model where you have a hub, which is where all of the medicines are stored. And then you have these light carrier trucks that drive, in some cases, hundreds of miles out to a very rural health clinic. And indeed, in some cases, even getting on a bicycle and making it through some rougher terrain. That's the map on the left. That's the sort of the intuitive way in which we would want to structure this. The map on the right is an optimized map. And what we have here actually is we now have refrigerated trucks moving in tandem with light carrier trucks in a very orchestrated way in order to optimize and increase efficiency in the delivery of these medicines to very rural and remote, out of the way health clinics. And as a result, and this is working with GPS technology and mapping technology, as a result, the routes that are driven in the right-hand map reduce the amount of travel by 34%. The average delivery time is reduced from 12 days to 10 days. So now medicines actually get to the clinics more quickly. And the system saves about 35% on fuel. And it also saves about 15% in the total cost in terms of efficiencies gained. So this is really impressive, right? So from a political economy point of view, this is really important data that I can use. And indeed, I can make the argument that the total cost of delivering medicines to these very rural, remote outposts and health clinics is reduced when we use this optimized technology and this optimization mapping technology. I can say the total cost reduces. And I can also say through simple math that the average cost reduces because I take the number of clinics and I just simply divide that into the total cost. And I can now say, well, we have reduced the average cost. Now I'm going to teach you a little bit about economics right now, a little bit of economics and anthropology. I'm in the field. So we spent time in this district. This is the Mwanza district in Tanzania. And I was out there with my student research team. And I know that indeed the system itself reduces the average cost and the total cost. But what I wanted to know was, how much does it cost to get to that one clinic way out there on the periphery, right? How much more does it cost for me to go from the mainland to that one clinic way off in the northwestern periphery? I know, because I was in the field, that it costs a lot to get to that one clinic in the Northwest because we needed to get on a boat, and then we needed to reload the truck, and then we needed to get on bicycles, and then we needed to find this clinic in the middle of nowhere. So the additional cost of reaching that additional health outpost is what we call in economics marginal cost. And so now I'm interested in, well, what is the marginal cost to reach that health clinic that is the hardest to reach? So in our lab, in the research lab, we started plotting data using real live data, and we started looking at the difference between the average cost of an intervention and the marginal cost to reach the hardest to reach people. And so this is some data that we published with two of my students in the bulletin of the WHO, in which we plotted data here, and the red line is average cost and the blue line is marginal cost. The horizontal axis is coverage, right? So you can see percentage coverage, 25%, 50%, 75%. And what we're most interested in the SDGs is 100% coverage, making sure everybody is reached. The vertical axis is cost per capita. How much does it cost to actually reach that person? When we plot this data here, you can see that after around 50% coverage, the marginal cost, that is to say, the additional cost of reaching one more person, starts to diverge. By the time we get to 75% coverage, now we've covered 3/4 of the population. Now we want to cover and we want to reach 75% plus one, that next person. Well, the marginal cost to reach that next person is actually 2 times average cost. By the time we reach the very last person, who is probably in the most remote part of the country, the marginal cost to reach that person is almost 4 times higher than the average cost. In other words, it gets really expensive to reach those who are hardest to reach. And this is what I'm working with my students now. The question I put to them is, how do we narrow this gap? How do we narrow the gap between the marginal cost and the average cost? And we know it's going to require innovations in technology. It's going to require innovations in business. It's going to require innovations in policy. It's going to require innovations in advocacy. And most importantly, it's going to require leadership. And that's where you come in. And I want to finish my comments now by saying, and really emphasizing, that's where you come in. Over the last 5 years, our REACH research teams, and again, these are all students, undergraduate and graduate students, all students have carried out research around the world. And these are the case studies that they've worked on. And it's an impressive array of work, and it's an impressive array of insights that they've generated. But this is where you come in. This could be your life's work. Now, I'm in my, I was going to say I'm in my late 20s, but I haven't been in my late 20s for almost 20 years now. My life's work is more than halfway done. You're just starting. And the opportunity you have as a young person, whether you're at the University of Toronto or somewhere else, the opportunity you have is to embrace these kinds of challenges as your future life's work. And no matter what your discipline, whether it's engineering, whether it's anthropology, whether it's literature, whether it's pure mathematics, this is an opportunity for you to employ your disciplinary skills to try to address some of the world's most pressing and prevalent challenges. So I want to turn it to you to say, as you enter into your university years, take what you get, learn from the professors, but recognize that this is all in preparation for your life's work and the kind of impact that you're going to have into the future. So I look forward to seeing hopefully many of you in some of my classes. And if I don't, I look forward to hearing about all of the terrific things that you will do to have a positive impact on the world. Thanks very much for your time.
Thank you, Professor Wong. That was great, fascinating stuff. And something that, yeah, students that are watching, you can look forward to a lecture just like this